Good evening, everyone. Welcome to Platform Toronto. We're here to talk about COVID and community in our episode, and I must thank Triangle Palmer, particularly Ronnie Palmer, to have organized such a wonderful session. And uh, I've got four guests with me tonight from different genres, disciplines, and I'll invite them one by one. First of all, let me invite Ms. Doly Begum, MPP, Scarborough Southwest. Hi, Doly. Good evening. I think you need to unmute yourself so that we can hear you. Oh, yeah.
Perfect.
Great.
Hi,
How are you?
I'm doing well. Thank you. Thank you for having me again. It's always wonderful to join Platform. And well done for the work you're doing.
Thank you so much for being a part of the whole thing because, since the inception of the entire stuff that we're trying to do from Platform Toronto, you have been there quite supportive in different issues, right from it to whatever community issues. Thank you so much for being with us tonight as well.
Absolutely.
We have got a couple more guests with us tonight. We have got Dr. Shahryar Murshed with us, who's a medical researcher from Sunnybrook Hospital. Hi, Shahryar, how are you?
Fine, thank you. Assalamu alaikum.
And thank Shahryar as well, because since inception, he has also been quite a great partner to this entire initiative. He has been tremendous. I cannot but mention that how many hours we've spent together to plan out how we will go forward with a particular issue on platform. Thank you, Shahryar, for that.
My pleasure.
Great. And then we have Dr. Sweetie, who will be joining us. Dr. Sweetie is there. MBBS. Yeah, hi, Sweetie. How are you?
Hi, I'm fine. Hi, everyone. Very nice to meet you, all of you guys here. We are very happy to see you all. Good evening to everyone.
Thank you for joining us. And
thanks for inviting me.
Nice
to meet you, Doly Begum and Shahryar Bhai.
Great.
Thanks.
We were looking at the banner and we've seen all of us there, but there's a surprise guest whom I could really coordinate at the very last moment. She's a very popular family physician and general practitioner, Dr. Kavita Randhawa, and she's joined. She could manage to join us. Thanks.
Hello. You give me too much credit. I am honored to be part of the crowd tonight. Thank you very much for having me.
Thank you, Kavita. So we have got the whole team here to talk about COVID and community. Well, they represent different disciplines, and I'm sure it will be quite a thought-provoking discussion that we're going to have. And audience and anybody who's having a look at it, so you can put your comments, throw your questions, and we will moderate accordingly. And for all the participants, if you want to share in your Facebook or any social media page or account, just copy the URL that you're in and put it there. So first, let's go to talk to Doly first. Doly being the community rep here tonight. You've been mixing with all spheres of people in the community in different issues, right? And the first thing that I really wanted to know, or I had a couple of discussions with a couple of people from the community, and it's a question, you mix with different spheres. I mean, what really made it happen to have this second surge of COVID? I mean, you must be knowing it quite thoroughly because you're out and about in different places, mixing with different people. What do you think is the main reason for this surge coming so heavy and high this time?
Well, first, let me just start by saying it's a pleasure to join with three different doctors here. And I'm looking forward to listening to all of you and your expertise as well. And thank you once again for inviting me to Platform and for all the great work you're doing, creating awareness, especially during the time of COVID on all different topics. I think, the answer to the question in terms of the surge of COVID-19, obviously the medical experts will have much better idea of some of the ways that we have seen our community have many of the communities have much more of a higher rate than others. I know I'm in Scarborough, so Scarborough Southwest is the community that I represent as the provincial member of parliament, and we have been facing a very, very high number. And some of the communities, some of the neighborhoods have been impacted much more than other parts of the province, other parts of the country. And for that, I would say there are quite a few things. And one of those includes the types of work that people have here. We have essential workers, a lot of frontline workers, healthcare workers who don't have an option to stay home. And that's just a plain simple fact. People have to go out to work. They have to expose themselves to the virus, and they're at a higher risk than simply saying stay home. And the other portion of that is related to those individuals who have to take the public transit, for example, which is packed, and they go to workplaces that are also much more unsafe than other workplaces. So for example, we have a lot of factories, workers who work in factories, large assembly lines, and sometimes not all the workers feel comfortable coming out and sharing the risks because they're afraid of losing their jobs. We also have a lot of people who didn't take it as seriously. I think sometimes what the COVID virus was initially, and a lot of the trends we noticed in the first wave kind of continued as well. And I think the third thing I will say, and I obviously will stop there and get the doctors to come in, is that I think we learned a lot of lessons from the first wave, or at least we should have, but we didn't really take those lessons and utilize them in the second wave. I think there are a lot of things that as government officials, as policymakers, we should have done. That we could have done better in terms of protecting people, putting certain measures to make things available, like school reopening. We should have done that much safer. Childcare, we should have made sure that our healthcare, hospitals, etc., were much more prepared. So I'll stop there because there are quite a few things that I could go on, but I know politicians talk a lot, so I'm going to try to change that sort of sentiment here.
Thanks, Doly. Taking it from what Doly was saying. Mr. Shahryar, we're talking about the surge, and Doly talked about the wave. If I may ask you the question, where is the wave, and what is the wave? What is the number of wave, and where we are in Toronto or GTA? If I may.
Thanks once again for inviting me. What Doly was saying, and others would agree as well. So it's frightening. It's scary, right? As I was talking to you before, that if it doesn't impact us personally, we don't feel the hate. We see what has been happening. What Doly has said, I must respect, people are going for work and everything, right? But also some people who get exposed, like it's pure ignorance. People thinking that it's not my problem, it's someone else's problem. So who are getting affected? The loved ones are getting affected. The vulnerable population, the elderly are getting affected. And by surge, you all know what the epidemiologists would prefer as. It's just a wave, right? So you see the numbers. So we see the first peak back in late last January, 2020 January, right? So the wave was up, it went down because laws were there. People were getting served and people stayed home. They didn't know what the virus is, and people were lax, right? Everything opened up, but the virus did not change its habit, should I say, in layman's term. It's a very contagious virus. One person infects 3, so it propagates, right? That's why you see these steady 3,000 numbers going up. And so now we have the second wave, so the number has picked up again. The only country that had successfully contained it initially was South Korea, actually. It picked, it stopped, but now COVID has struck. So in terms of number, I know people get bored with the numbers, but still we need to do the crunching just to have an idea. As of yesterday, some 1,400 people were hospitalized, right, altogether. And we have now, today I have seen the number as that 400 ICU admissions. So last couple of days, the infection rate is 3,000 on average. So that's a growth of, say, 6.2% positive growth. So if this goes on in next 2 weeks, say 24th of January, if the rate is 3%, then you are seeing 6,000 cases. It's not a matter of joke. And if the growth goes up to 5%, you could see almost 14,000 cases a day. But are we going to see that peak? Probably the government is going to intervene. The provincial government has said that they're going to come up with the new numbers next week, and which could be scary. I don't know what intervention they are coming up with. So that's what the surge is all about. And I didn't even talk about the burden the hospital system is having, right? So if you have ICU admissions more than 300, then you have to reserve some spots for other ICU cases, right? And that gets compromised. So what the hospitals are doing in the northern part of the country, so this is disproportionately affected where the population is, right? So in the northern part of the country, the ICUs are vacant. So they are told to keep their 1/3 of the capacity reserve open for COVID cases. And their inter-transfer of patients now in the hospitals. I've seen at Sunnybrook, we have been told, I'm not a clinician, I work in public health, but we have been told by a circular that we have to now admit cases from different zones and regions, right? And just to let you know, to your viewers, other hospitals have pediatric wards and pediatric patients. So they have been instructed to shift all their pediatric cases to hospital for sick children. So they could open up spaces for adult COVID cases. And last but not the least, all the elective surgeries and everything gets stalled, right? So this is the effect of the surge you are seeing. And in terms of number, and if you see that what the impact is the surge gonna do to us on an individual level, you see increased morbidity, people are dying, especially the elderlies, they're the vulnerables, the morbidity, you see more people are getting sick. Although we had in this province in 1 year, say 208,000 affected, 175,000 got cured. Flip side of the coin, that's a good news. But the thing is that people are suffering and there are post-COVID symptoms they are having. So which is not good. The businesses are getting closed.
Yeah.
That's a livelihood. The schools are closed still. That's one of the things. And you expect strict public health laws to come and get enforced.
Yeah. So things are a bit scary. I mean, Kavita, if I may go to you, that both Doly and Shahryar was saying that people do not really take it to themselves. They think that it's somebody else's problem, right? Until or unless they get really affected, either they or any one of their acquaintance or family members. So, as a physician, as you're you're taking care of families, individuals, patients. I mean, what do you see? I mean, what do you observe nowadays? I mean, are we really relaxed as individuals, or we are careful but careless? I mean, what's your observation?
You know what? I believe all humans are good somewhere. And in what's happening in our practice at Young and Finch area, also Scarborough Health Network, I work at Centenary, touching on what expertise of Doly and Mr. Dr. Murshed, and even Dr. Sweetie, you're going to know that it's a combination. That's why this damn thing is so hard to control. I have people that are serious business people that have urgent essential care businesses. Let's, for example, tell you in Bangladesh, they produce PPE. They are Canadians and they are from Bangladesh. They need to travel between both countries, for example, to run the business and help provide the world with PPE. So they get tested. They come into my clinic. I do their blood pressure. I do their flu shot. And then they tell me, you know what, Dr. Kavita, I have to get on a plane and I have to go to Bangladesh. In 72 hours, I got tested. And they're COVID positive the day after that they've been in our office. Kind, well protected, wearing a mask, no symptoms, patients, well-meaning. That's why the world has shut down, because not only is there complacency and burnout, and yes, many people have turned off the news, but much like what Doly says, it's the factory workers, it's the lack of distance, it's the inadequate PPE that is being provided to our PSWs, to the people that are in the front lines. They are given inadequate hygiene measures. They don't even understand, like, hey, listen, you should be using an N95 and face shields, and you shouldn't be taking your stuff off at the foot of a patient's bed to change into something else. We're dealing with an airborne virus. Others walk in with their masks hanging on their chins and their noses. So it's a combination, I would say, and that is why it is insanely difficult to control. And I absolutely support the government's ploy now to shut things down and lock everything up as much as they can. because we are exactly on how Dr. Murshed has touched upon, and very scary times. It's hard to control. You have crowds of teenagers, you have careless people, you have people who think they're protected with their mask hanging under their nose. They've got inappropriate cotton material. It's a spectrum, and it is so difficult to control. And that is why the government has to come in with lockdown measures that my crowd fully supports.
Yeah, it's true that we are into a very strict measure, and probably it will become even stricter. And sweetie, if I can go to you, and uh, I mean, the stricter the whole thing gets, the other part of the story, which is the mental health, affects more, since you worked a bit on that area and are practicing
Yeah.
rather. So how would you look into it?
Thanks.
I mean, the mental health issue. Yeah.
Yeah, thank you so much for inviting me here, and I'm so happy to be part of you guys. And I just want to mention, I'm a specialist for medicine and in my back home, but here I'm not getting license here to practice, but I'm working with the mentally disabled people in Regeneration Community House. So it's a very difficult time, not only for the, because in my family, my husband has COVID-19 also, and now he's suffering from like post-COVID syndrome, which is very complicated right now. So he cannot go for the work. He's also doctor in back home, pediatrician. So it's a very stressful for our situation, our family also. And the kids are getting depressed because they cannot attend the school. They are attending school by online. So it's not for only the mentally disabled people they are worried. Actually, the general populations are a little bit depressed, because we are facing the full pandemic situation for the last 1 year, which is not acceptable for all of us. So actually, we have to do our mental health to keep sound, because actually there is no separate mental health or physical health. We cannot separate each other, because it is related to each other. So we have to keep sound in mentally as well as physically. We have to do our regular works, because we know dopamine is helpful for our mental health. So we have to do our activities like we can walk around our house. We can go for the physical activities like gym, sauna, just inside our home. So we can do our regular activities. We can go for socialization by like messenger call. We can chat each other, because we have to maintain our physical distance. So we can go through the Facebook or messenger. We can communicate with our parents or relatives or friends. So we can keep ourselves good, sound, and happy. Actually, we have to face lots of complications and lots of our situation, but we have to overcome it. There is no prescription for these things, for getting mentally quiet or sound and keep. So we have to give more confidence in ourselves, and as well as we have to do our regular activities. We can cook ourselves for the families. Like, we are stuck, but we have to overcome the situation.
Right. We
I
have to,
think we have to accept.
yeah, yeah. As you were saying, we have to give due importance to this factor as well, that mental health matters, right? So that cannot be ignored. Going back to Dolly, Dolly, you were saying that we have been, all the doctors, they're giving all the insights, the physical thing, the thing, and all, but things have certainly deteriorated, and we're hearing that a new modeling will be released next week, which Dr. Shahryar was saying that might be a little more scarier, and we could have as big as 40,000 cases a day. So what could have been done is a past issue, if I may say. I mean, what do you think could be the forthcoming restrictions, or we have questions, we'll take it, but what do you think could be the right thing, the additional steps that we might undertake in the community to stop the spread or the surge?
Yeah, well, that's a big question, isn't it? I think that's what we're all trying to figure out. And I mean, everything that we're thinking about, the one goal that everyone has in mind right now is obviously, and I believe some of the viewers are already questioning, writing the questions down, which is how do we build immunity? How do we make sure that we have, we get the vaccines, for example, which is, I think, in everyone's minds right now. I know I've just been meeting with hospitals, with Scarborough Health Networks. I met with just a few days back, and then I met with Michael Guerin. And one of the things we do as political representatives is making sure that our areas have exactly what they need. And what I find is that obviously we have to have the vaccine, making sure that we have the vaccine as quickly as possible. And just recently, actually, one of the things I learned was not only are we going to have to come up with a good plan for making sure everyone gets the vaccine, so all the people that we have here who are actually on the front lines, and making sure that there's, our elders, people who are vulnerable, other essential workers, and then obviously the general public. And I think while we focus on that, the other thing is making sure that we're going to have enough vaccines, because the other worry that we have now is we might run out sometime soon, and that's what I'm hearing from some of the hospitals. And I'm hoping that we will be able to have the federal government provide more vaccines as well, and I'm really hopeful for that. But when we talk about some of the things that we need to do right now, and I think there's also some learning in that, in terms of what we could have done. One thing I think we could have done is prepared our healthcare systems much better, really strengthening our healthcare system. So making sure that we had, Dr. Kavita just talked about how our system is, and how we're very much stretched thin in many of our sectors. If we had really invested in our hospitals, in our communities, making sure that our communities have the support that people need, and their immune systems a little bit stronger as well, we could have been able to fight harder. I also think that, I'm very biased because I represent a community that's very diverse. So this is what my focus is. Ontario is my focus. I mean, right now we have about 4,000 cases here. In long-term care, we have almost 3,000 deaths, and 1,000 of these are just from second. To me, that's preventable, because if we had taken the measures we have learned, that could have been prevented. The other thing I would say is, why don't we hire more in our hospitals? And that also relates to what I think, the fact that we have a doctor here who had to go through the process of being recognized in Canada. We have many Bangladeshi Canadians, many Tamil Canadians, many other diverse Canadians from different countries who are professionals. And they have these skills and expertise. And right now you come here and you're climbing up the hill to get to be recognized, because we don't even have a proper system to actually have these people go through it because of procedural failures. We don't have that system to allow these people like Dr. Sweetie right here to actually practice her profession. We have a pediatrician right now in her husband who could be in the system helping us during COVID.
We can do another chat on that. Sorry to interrupt. I can do a whole other evening course on international medical grads and their need to be licensed in this country, and why there is a problem. And trust me, there's a whole backstory to that issue.
But like one of the things, whenever we talk to the government, the Minister of Health or Minister
So
of
I am requesting Doly Begum will raise the.
Yeah, Doly, do it for them. Do it.
And so, and let me just tell you one thing.
I think Doly will help for
the one thing that was extremely frustrating is, for the last maybe 2-3 years, we've been like, this issue has come forward, and I've been elected since 2.5 years now. We've been talking about this before COVID, and we knew this was a problem in our healthcare system before COVID. When COVID hit, we saw the government try to take advantage of these people by allowing them to become volunteers or interns for 2 days. I mean, they're trying to take opportunities where they need these people who have certain skills, but why not actually get them on the profession, allow them to practice what, and they will, that, imagine the opportunities we could have created, imagine the flexibility, imagine how much relief we could have given to the doctors and nurses we have in our healthcare systems right now who are so stressed, and imagine how many more people who could have been treated. And I'm sorry, I'm just so passionate about this because I think it was just an easy solution that we could have just been a little bit more ambitious about, and we could have done so much better, but we didn't. And we shouldn't take advantage of the people and then forget about it, because that's what we've done right now. We could have done so much more. And I still think we need to
Right.
continue to work towards it. And I feel that there's still ways, I think our government, all of us could.
Can you hear me? Sorry.
Thank you so much, Dom, because you are thinking about skill community in this part. So I think do something else.
Well, I know the journey very well. I was waitlisted for medical school in Vancouver. I'm an honors microbiology graduate. I'm born in the UK, raised in Vancouver, British Columbia, married in Toronto. I am an IMG. I had to go to Dublin, Ireland for medical school. I'm born in the UK. I had straight A's. I had an honors undergrad degree from UBC. I got first round entry. I was licensed in the US and Canada to get back to Halifax and to bring my skills back to Canada. But let me tell you, I was very close to going to the US because of how hard my own country made it for me to come back. But I help a lot of IMGs, and I have a lot of passion for this area too, Doly. So one day we should unite after COVID settles. And I will tell you, financing and money is a huge concern in the Canadian government as the barrier to this. But I have a lot of free ideas that certainly can help the government and help. But as per Taslim's topic of COVID today, I think it ties in. You're right. I think your message is we need help. We need help. We need help on all avenues. I have an email from the OMA beseeching us as primary care doctors, please come to the nursing home. Can you come?
I think, Kavita, you're breaking up. So one thing you could probably do is re-log in. You have frozen.
Sorry.
I think,
hear me now?
Oh, yeah,
Okay. Yeah. It's just the connection is off.
Yeah, now it's up.
Okay. Did you see me there? Sorry.
Yeah. But you're breaking up at times. You're frozen now, so I would suggest that you re-log in once again, so that
connection. Hold on. Is it my connection? Maybe it's my connection. But we need help, right? We need help. Right? We need help.
Sure. Yeah. So Doly, yes, I see. Let me remain positive that there's always a learning curve, and maybe we will learn, and there's never a wrong time to do the right thing. So hopefully it will ring in some time at some quarter of the decision-making process. But let me ask you a very stupid and very layman question. I mean, since
no questions are ever stupid.
No.
Working with and mixing with all spheres of the community, first or when the COVID first hit, you would agree that the second wave, second surge is even worse than the before, the first one. And when the first one was there, we had seen a lot of compassion among the people across different communities, not only here in Toronto or Canada, rather in different countries. People from one balcony to another playing table tennis, singing together and all. Where has that compassion gone? I mean, that's a simple question to you. I mean, did we learn that COVID is not going to affect us, or where has that gone? How has that turned into complete isolation?
Well, I think that we have to step back a little bit to talk about that, because in terms of and I think I'm gonna ask if all of us mute us so that so that we don't have echo. I think we have to step back a little bit, because I know the energy was really high in terms of encouraging each other, but the problem is there is obviously COVID fatigue because everyone's just tired of being, told to stay home, do these things, do the right thing, and people are trying. I honestly believe people are trying, and when I talk to people, when I have many of the Zoom calls, and we have so like today's a Saturday, I've had multiple Zoom calls today just to have continued to communicate with community members. I think people are tired. And the other thing is people run out of resources, right? We have to keep boosting the resources that people need. I mean, whether it's government aid or community support, people run out. And in terms of our community, we saw our community organizations, individuals come forward even more before we had, served, for example, before we had any support for businesses. We know a lot of the businesses that were helping people with low-priced meals, were donating meals. Some of them actually ran out of business. Like some of them have literally been locked out of their business. And in a way, yes, this is a crisis, and yes, this is a huge. I think we're going to recover in a very long time. The recovery period will take many years, but there are some things that I think we could have managed better to rescue some of the things, and that includes businesses is one of them, because we lost a lot of businesses that closed their doors forever because they didn't have enough support. Many went into their personal loans and they ran out. They just couldn't keep up. And there are ways we could have supported those individuals. There are people now, for example, in some of the buildings here in Scarborough who have COVID, people who have lost jobs. So that energy that we had to support, now they're trying to figure out how they're going to cook themselves and how they're going to sustain their own families before they go out in the community. And I think the other thing is people are also figuring out, the way that, like how do we get back to normal with the new normal? Like accepting that we have to wear a mask, we have to go and do our job while trying to accept the reality. Whereas before it was something new and we were trying to address it in a different way. So accepting that new normal has been a big part of it. And I think as we continue, I hope that we're able to get the vaccine soon, and we're able to fix a lot of the issues, and maybe we will be able to get together soon and actually shake hands and hug people, and I'm really glad that we're heading towards a better path, and I'm hopeful for that as well.
Yeah, same here. And I've got two quick questions to Shahryar. Number one is, as Doly was saying, the power of adaptability to this whole new normal thing. The first question to you is, do you think we have failed to do that, which has resulted in the second wave surge or the worsening situation? And the second question is from one of the viewers, how to build in more immunity among the elder generation. So there's two questions to you.
So to answer your first question, I think we have dropped the guard a bit. In terms of government support, you have been seeing the government is, both the federal and the provincial government is trying their best. Maybe they are not perfect. This is a new thing. As Doly was saying, it's a new normal. We have all been tested. All the system is under testing, right? In terms of vaccine delivery, in terms of medication, in terms of treatment, care, support. And as I said, the virus did not change its shape, form, or behavior, right? It's still like it's preying upon elderlies and stuff like that. But as I said, we as person, as a society, we are in it all together, right? Unless we support each other, unless we support the government, unless we follow the public health rules, we would still see the cases going up. If you compare Canada or this province with our neighbors at the south side of the border, we are in such a better shape. Kavita is from UK, right? So what has been happening with UK? Since at the beginning, they went out for herd immunity. They kept their seniors at home, let their young go out. They brought the disease, and then it's a wildfire, right? And they could not control. Europe has been, it's a disaster, right? They have been trying to control. Canada is much better off with this situation. So I won't say that we have failed. I would say that we did just put our guard down, and we could have done better, but it's still there is way, and always we are seeing light at the end of the tunnel. So I hope we would recover from this situation. And to answer your second question regarding the immunity,
Yeah.
so if you're talking about the active immunity in terms of someone infected with COVID, like Sweetie was saying, her husband was affected. So it has been seen that even though someone develops an active immunity, getting the disease, by contracting the disease, it fades off after a couple of months, right? A study has been done in the UK on 100,000 post-COVID cases, and it has been seen that the immunity level going down 60 to 50%, like going down in 6 months' time. So it will fade out, and we have seen a couple of cases reinfection, right? Now come to passive immunity, like getting the COVID shot. As I said in the trial, it hasn't been tested long term on population to see how long the immunity would last. Pfizer was saying that it may last a year. If COVID persists in the community, it could be a seasonal thing. We need to get the vaccine yearly or even a booster. We don't know, right? My understanding is that if you
Right.
compare with the flu shot, and Shireen was saying one of the questionnaire, what effects it would have on elderlies. It has been seen that if you compare with flu shot, the immunity would develop, like say, in 2 to 3 weeks time. Unless you measure the antibody titer, you won't know how effective it is. Kavita may shed light on that thing. So in terms of COVID, we don't know. Um, in terms of elderlies, we may need to get a booster just to bump up their immune system. But as I said, what Pfizer was saying, the efficacy after second dose is 95%, right? So that's what we could hope for. So it's just wait and see and just hope for the good things.
Yeah, it's time can answer better. So Kavita, there's one question directed to you. Is there was one viewer who was saying that there are certain things that we have to do regularly, which is grocery shopping kind of stuff, right? So and there's a very high chance of getting contracted in this kind of exposures. So what would be your suggestion for this regular activities? People who do groceries regularly, who goes out regularly. That's one question, and that's from one of the viewers. And the second question is from my side, is regarding the vaccine thing. I still believe there is a portion of the population who are a little confused about the vaccine thing, and despite of the repeated press thing about its efficacy and everything. But then again, they are a little. I think the confusion lies to a certain level of percentage of population. So there are two questions. The first one is what would you suggest for the regular activities that people do, groceries and shopping and all, and the second is the efficacy or the very misconception, if I may say, about vaccination.
Okay, well, thank you again for having me. I think what I always tell my patients is just pretend everybody around you has COVID. And so when you go for a grocery shop or a gas station, wear your mask. If you can, wear some eye protection, maintain physical distancing more than 2 meters, and wash your hands when you get home. Now, a lot of patients were cleaning their groceries and disinfecting things like crazy after they came home from shopping. Well, it's not very necessary. What some people have done is just left a section of their fridge where they would pre-buy groceries, leave them there for a couple of days, and then use them, because COVID can live on hard surfaces, and that's another thing people don't realize. So it's important just to not let your guard down. And really, that's the bottom line. It's an airborne virus. So the second thing that we tell patients, I mean, your second question about basically the vaccine and immunity, I suppose you must be leaning on fear of vaccine. We are getting very cutting edge research coming out of the pipeline now that is showing that the vaccine is very safe. And I can speak for the Pfizer vaccine currently, the allergic reactions that have been documented worldwide. Well, it's an ingredient in that vaccine that we already have. It's a very robust ingredient in many of our medications and current vaccines that we use called polyethylene glycol. So this is an ingredient in the Pfizer vaccine that is promoting allergic reactions in lots of people. But hey, at the end of the day, if you're somebody who has a severe allergic reaction and who cannot take, for example, the standard flu shot, well, talk to your doctor, because we're not recommending that you get the vaccine if you're having severe allergic reactions. To calm down fears of vaccine in general, at the end of the day, we know that getting COVID, the disease, has longer term consequences for ill health versus obviously getting vaccinated. The vaccine is priming your immune system in two ways rather than just one way. When you acquire natural COVID infection, your body only fights with one B cell response. When you get a vaccination, your body has what's called the natural killer response, as well as the B cell response. So a double response to punch out the vaccine, the virus. Now, it won't stop you from getting the virus, but it will stop you from getting a severe version of the virus. It will stop you from having these poor long-term effects that Dr. Sweetie's husband is now going through. Chronic COVID and COVID, post-COVID syndrome is a reality. I have 36-year-old patients who are in stage 3 heart failure post-COVID, otherwise healthy Southeast Asian guy from Brampton. All right. So he's not a diabetic. He's not a hypertensive. He's not a heart patient. And cardiologists are puzzled. Half of his heart muscle is dead post-COVID, and it will not ever regain function. He's on 5 million different medicines for it. So what we know is the vaccine is safe, it is effective, and if we could only dream that people could view it as liquid gold so that they would line up as soon as they can to get it, it's a miracle. It's a miracle to try and, let you know how advanced science has been to make this vaccine available in less than a year. It's a Nobel Prize winner. It's honestly unheard of. And I think we should all be lining up and rolling up our sleeves and feel privileged that we're in a country that has over-ordered supply. So Doly, speaking to your fears about not getting enough, there's tons. And as a matter of fact, there's an oversupply. It's just not here yet.
It's not my fear. I recently heard from the Michael Garron Hospital CEO that she's
I know. I know. There's
worried.
in quotes a shortage today, but let me promise you, Monday and next
We'll
week,
order more.
I mean, these things are coming in waves of shipments, and they're already pre-purchased. So it's the same, in any field where the companies are, sort of aliquoting out their shipments.
Right.
So yes, of course, I have, patients who are nurses at St. Michael's downtown. Their ICU is full. It is full of COVID patients. It is a dire situation, things you are not hearing on the news that we hear in the background, that we know what is happening here on the front lines. It is absolutely terrifying. And I agree, the fear and panic among the medical community lately about shortages and doctors rushing to the lines and nurses and PSWs trying to get the vaccine ASAP. It's a bit of a fear right now because we want to hurry up. We want to get everybody vaccinated as soon as possible so that we can stop the community spread. So any fears, you're welcome to contact me through Taslim as well. I've got my email address, and we have an Instagram handle, and we have an office website. But I really would love to connect with all of you and take your emails and your expertise and be in continual connection to keep on educating our community. I have one philosophy in life. I practice medicine the way I would treat my beloved family members. Okay. And I always put your choice in your hands. But at the end of the day, if you're my family member, can't wait to vaccinate.
Thanks, Kavita. There's a little question. I think it's a little difficult question to regarding mental health, and I want to throw it back to Dr. Sweetie. That yeah, it said that mental health is important, but as being said or being said by Dolly and others, that putting food on the table is very important, right? That comes first. That you earn, you work,
Exactly.
and you think.
And the thing is that,
So if
yeah, the
that
thing
is
is
not
that in my opinion,
provided,
actually,
yeah, go ahead, please.
I can't listen to you. I can't hear you. Like, what do you say
So
right now? What do
putting
you
food
want to
on
ask?
the table is putting food on the table. Earning money is a first priority, right?
It's very difficult.
When
Exactly.
when it gets really
Right.
hard, it gets affected. It is very difficult to balance the mental health from that perspective, right? So if somebody is really affected by his or her income, the support, the economic condition, the family condition, so what would be your suggestion to kind of for him or her
And
to balance out the mental health?
exactly. So the thing is that, in my opinion, we have to put the food on our table because we have to face the problems. We have to go to our work because my husband is working for last 3 months. So I have to go to work as a frontline worker. I have to work with the mentally disabled people. So, like my family, lots of family in Bengali community, they have to go to their work as an essential worker. So there's nothing to do because we have to survive. We have to survive in this place. Though I am a specialist physician in my back home, but here I'm not doing nothing. Like only the residential support worker. Like I am doing my 16 hours night shift for the, last night also, and tonight I have the night shift because we have to go through the system, and system is stuck. So the thing is that we have to balance, and there is nothing a prescription we can prescribe the drugs or medications for the mental health. If we sound good in physically and mentally, it is related to each other. So actually we can say we have to be happy. How can we have to be happy? So we have to balance like our work, family, and everything. We have to make a balance during our work time, our family time, because for me, if I think about myself, I have to go to the work, I have to take care about my family because I have 12 years old kids. She's sometimes feeling like she's feeling depressed. Sometimes she cannot go to the school. So, and she's coming from Bengali, Bangladesh, and then is coming here. So it is totally new situation for her. The COVID-19, actually, the new situation for the whole world is the pandemic situation. Nobody is knowing anything. But my suggestion, like everyone, we have to get our vaccine because we are lucky enough getting vaccine in Toronto. And the federal government and provincial government are supporting us as they are level based. Like we are getting lots of support which is not possible in our developing country in Bangladesh. They are not going for work and they are getting the payment. It's not possible in Bangladesh, but we are lucky enough here in Toronto, and we are getting lots of facilities from the provincial government as well as from the federal government. So I think we have to doing we have to do our normal regular works, and we have to keep ourselves happy, trying to be happy, like doing our normal things. When I work with mentally disabled people, because they are mentally challenged, I don't want to say that disabled, they're challenged people, and I'm working in a regeneration home, so I have to work with 10 different like schizophrenic patient, bipolar patients, major depressive disorder. So I can see like different types of mentally disabled people, and they can maintain the rules. So if they can maintain the rules and regulations, why normal general people cannot do their normal activities? So we have to keep distance. We have to maintain that social distance, physical distance. Like we have to wear the mask. I'm using hand sanitizer with myself. I have to carry myself always because I have to sanitize all the times. I have to keep my personal hygiene. I have to maintain my personal hygiene. Everybody should wear the mask. Everybody should carry the hand sanitizer with them when they are going for the work. I mean, the essential worker, they have to go, they have to survive. So we have to face those problems. There's
Right.
nothing to do. We have
Yeah,
to do,
we have to
and
adapt.
everybody.
Yeah, you're right.
Yeah,
That
exactly. We have to
know
adapt
has to be
everything.
embraced properly. So,
Exactly.
Doly, we're coming at the fag end of the program. So, what would be your remarks, advice to the community, suggestions, if I may request you to coin some words? Dolly, can you hear me?
Yes, I can. Sorry.
Yeah.
You
So,
just-
since we're coming at the fag end of the program, so we want to hear some your closing remarks on to the community or advices, suggestions.
Absolutely. Well, thank you so much for having me on Platform. I think we had a really nice discussion, and I'm sure the viewers will appreciate it. All I have to say is, continue to listen to the medical experts. We have someone from a physician. We have Toronto Public Health, or I'm not sure if it's Toronto Public Health, but it's public health. We have mental health, and the expertise, they do matter. I think we have to make sure, as general public, we have to make sure that we follow the guidelines. I do want to say that I believe that there is some of the works that we are doing continue to happen. I remember before COVID-19, one of the things I felt passionate about, which is why I joined politics, was healthcare. That was something that I wanted to work on. I wanted to make sure that we continue to strengthen our healthcare system. And it's something that I will continue to do because we have to make sure that the way we have been able to survive through and we will continue to, the only way we can keep that up is by making sure that our hospitals, our doctors and nurses are well equipped and making sure that we're protecting them as well. So I think it's also another responsibility for us is to make sure that you're protected, is that you feel like you have all the tools necessary to do your job. I would have loved to talk more about the international skills development, and I hope Dr. Kavita and Dr. Murshed and Dr. Sweetie will work with me on that as well. I look forward to that. And also on the idea of mental health.
Thank you,
We
sir.
Yeah.
that's a huge discussion on its own because right now we have a lot of kids who are studying at home, and the mental health impact of that is going to be huge. We have a lot of seniors who were not just dying from COVID, but also dying from just loneliness, the lack of care, and what's happening in many of our homes, and just a lot of families, I think, are dealing with health problems as well. The surgeries, the backlogs, and obviously, I know for many Bangladeshi Canadians and immigrant families, আমি বাংলায় বলি যে আমরা সবসময় ব্যস্ত থাকি আমাদের বাড়ির পাশের বাসার মানে দাদি নানা নানি সব, we're all together, you get to see everyone, but here you're already isolated, and now imagine with COVID what's happening. So I hope that we get through this together, and I look forward to working with all of you in the great work that you're doing, and I hope that we can all see each other in person soon. So thank you so much.
Sure. Thank you, Dolly. And going back to Shahryar, Shahryar is a person who knows a lot of numbers. He knows a lot of research that goes on, but he hates to quote numbers. That's what I like about him, because he believes that uttering all these numbers will scare people. So let us not ask about numbers, but this is true, Shahryar, that things have gone worse, and we are afraid that it might get even worse. So what would be your take, your suggestions to the people who are listening, seeing us, viewing us, or to the community as a whole?
So we are in a juncture, it's a balance issue. Now you have the vaccine, right? So the vaccine ramps up and we get our shot. We get close to a herd immunity. We keep ourselves protected. We keep the community protected. I hope what the policymaker, Honorable the MPP was saying, Doly, that from them top down, they're going to come up with firm policies that would ensure that people are safe. We'll get the vaccine. There are employment issues, uncertainties, wage issues, and people like Dr. Sweetie, who covers mental health, make sure that people are working well, mentally stable. Clinicians like Dr. Kavita, relentlessly as a frontline worker, working and helping people clinically. The hospitals, they are coming up with better treatments now. And people like you, Taslim, and Platform, who are doing this talk and creating awareness. So as you see, we have people from different parts of the community, and I made everyone happy over here. So by naming you guys. So we come together and we hope for a better future. And I still believe we have good days coming ahead, and it's a matter of time. We just have to hang in there, and we should not, as I said, drop our guard down. And probably maybe we have a reunion next time after a year, and we'd recall how things were. Maybe you would run this tape and see how scared we were, and we will have a better time.
Thanks, Shahryar. And as Shahryar was saying, and Sweetie, you were mentioning earlier that no matter how things go on, we have to remain positive. We have to take care of our mental health and all. So, what would be your last few words to the viewers, Sweetie? Sweetie,
To the viewers, I just want to say, just yeah, we have to maintain the things because COVID-19 is really the scary situation right now. We have to maintain all the public health rules and regulations. We have to wear our masks regularly and maintain our personal hygiene properly. Not only that, if anyone in your family is affected by COVID-19, just make sure you are safe. So in my family, like my husband was suffering from COVID-19, so we are isolated from him, and alhamdulillah we didn't have that yet, because we have to keep ourselves safe. And I want to tell, we have to face all the like difficulties right now. We have to overcome this situation because everybody in the world like take the step to overcome the situation, and we have to solve our problem by ourselves. Like Dolly can tell us the advice, but if I am not maintaining the advice, that's my fault, my lack of awareness. So nobody can aware you if I am not aware about the rules and regulations, and I have to protect myself from the COVID because it's highly contagious as well as the infective.
Yeah, we have to do
So
our part.
I tell everyone, please maintain, and we all have to go through that togetherly.
Yeah.
We have to unite together. That then we can overcome the problem. I think so.
Absolutely. And very last, Kavita, more than doctor, I believe that she's a person who is so encouraging, so caring to the community, not as a doctor, as I'm saying, but as a person herself. So, every time I talk to her, I don't look at her as a doctor only. I look at her as a person who inspires, encourages, and always remain positive, so full of energy. And we want to hear or get some of that energy to the viewers, to the community, as we have you here with us, Kavita.
Well, I'm very honored to be here once again. You guys are doing an awesome job in creating awareness. This is what the public needs to hear. They need to hear, look at me. I'm Dr. Kavita. I have a 22-year-old patient who has breast cancer, who is now waitlisted for surgery and oncology and chemotherapy to treat her. I just diagnosed her a week ago in the middle of my Christmas holidays. I have a 44-year-old waiting for cancer treatment. Doly is correct when she says there are normal cases of patients with serious illnesses that are getting backlogged and bounced because of places like Michael Garron and downtown. Everything is full of COVID. So the more you guys, as my public family, can do to protect yourself, to wear a mask, to socially distance, to seek mental health, just to add on to Dr. Sweetie's mental health information, there is free mental health counseling available. If you just Google free mental health counseling, Ontario, Toronto, Scarborough, wherever you are with your OHIP card, there is free mental health support available within 24 hours to you at your doorstep, on your smart device, on your computer. And I can't emphasize enough how important it is for people to reach out to resources, to use Zoom technology or socially distanced walks, taking up new hobbies in order to basically just buy time to get through this tough time, because there is a light at the end of the tunnel. And we have a vaccination, and we have very good news coming out of the vaccination scene as well, that we might have way longer time immunity related to this vaccination. It's cutting edge information. There is hope. And this will just be part of our annual flu shot, hopefully, come 2022. Let's cross our fingers. But we are on the last sort of path to this kind of lifestyle. And I really think we can all do it. We just have to do it together.
All right. Yes, we're all in it together, and hopefully we will come out of it very soon, and we all see the light at the end of tunnel. And good days are coming as you thought leaders, experts from different disciplines have rightly shed light and thrown enough of your experience that yes, the vaccination is there, the rollouts are there. Of course, there are issues. There will be issues. I mean, nothing is absolute or perfect in this world. But obviously, better days are coming, and we have to hold on to that. Thank you very much. Thank you, everyone. Dolly,
And thank you to
Shahryar,
you.
Kavita, Sweetie, for joining me. And hopefully, we'll get back to you once again and have another round of discussion as it progresses. Thank you so much. Have a great
Thank you, Taslim. Thank you.
you.
Thank you, audience.
Thank you, Taslim. Thank you, Valentine.
Take
Thank you
care.
so much.
Yeah.